Hello, and welcome to another episode of Instagram Live TV with your host, Dr. Gregory Buford. I'm the board certified plastic surgeon and medical founder of Beauty by Buford. And I will be joined by my good friend, Dr. Ava Shamban, in about 2 minutes. Dr. Shamban is a board certified dermatologist in Los Angeles with offices in Santa Monica and Beverly Hills. I have had the opportunity to speak with her on a number of panels across the country as well as outside the country. And she's always been a great friend, a great resource, and someone that is just full of wonderful insights. So today we're going to be talking about who should you see, your dermatologist or your plastic surgeon. So stay tuned. Those of you who are joining us will start in about 2 minutes here. We're just waiting for Dr. Shamban to join us. Hope you guys are having better weather than we are in Colorado right now. If you can see outside my window, it's actually snowing. It's 35 degrees, and certainly quite a different surprise than we had this weekend in Denver, Colorado. So, looks like Dr. Ava has requested to be on the live video. Ladies and gentlemen, Dr. Shamban. Ta-da!
Hi.
Ava, how are you?
I'm good. I'm good. I just heard you say the snow. I know it's snowing. It's snowing, and then there's fires too, right? I hope it puts out the fires.
We've had the craziest weather. We literally went down about, let's see, it was almost 100 degrees over the weekend. Woke up this morning to basically about 35 degrees. No snow on the ground. It's just too warm, but got the winter coat out for a day, and then by the end of the week, it's supposed to be back in the 90s. So welcome to Denver. The only place crazier than LA. So
yeah, that's and that's hard to do. That's hard.
Right.
That's hard to do. Oh.
So Ava, I introduced you a little bit. So as those of you who are watching right now, as you know, Dr. Shamban is a board certified dermatologist. She has offices in Ava, correct me if I'm wrong, but in Santa Monica, Beverly Hills, nationally, actually internationally respected key opinion leader. Great insights, and you and I have had the opportunity on sitting on a number of panels. We don't always agree, which I think is actually a good thing. I don't want to always agree with them.
I do too. You don't want to have a yes person ever.
Right. And the nice thing is you will definitely inform me when I am incorrect. I love that.
Well, or I mean, so there's a lot of things that are, we can all live with differing opinions.
Right.
Still respect each other as professionals. Yeah.
So Ava and I were talking, so those of you who are watching right now, Ava and I were talking about the fact that obviously I'm a plastic surgeon. Ava is a dermatologist. We do a lot of the things, very similarly, but probably approach problems, issues, concerns, and what have you, from a different standpoint, with a different set of eyes because of my training and Ava, because of your training. And we wanted to talk today about, why is this? Is it wrong to have a different viewpoint as a dermatologist or a plastic surgeon, or is this truly, or does this represent the art of what we do? Ava, how would you respond to that?
Well, I think that our difference of opinions is a little bit based on some of our biases that we were, according to our training. But I think that over the years, I think that plastics and the surgical approach and the non-surgical approach have meshed much more quickly. But, it's interesting. I was thinking about it. I've never been in the OR to see anybody I've seen a brow lift, but I've never seen an actual facelift.
Mm-hmm.
And so I need to come out to Denver and watch you do one.
Well, you don't want to see me do a facelift because I haven't done one in about 15 years, but yeah, so I'm mostly breast and body. So, but you're always welcome to come out. I mean, I think, it's interesting. One thing that I think you and I were talking about when we were planning for this talk is, there's a lot of value actually when you talk to a plastic surgeon, when you talk to a dermatologist and you get different viewpoints, because truly what we do is it's the art of aesthetics. It's not, it's the practice of aesthetics, but, to say that how I do something, how I inject the cheeks, for example, or how I rejuvenate the skin. You may do it completely different, and you know what? You get great results, and so do I, because it's really the art and it's being able to appreciate that I have a different aesthetic, maybe, right or wrong, and so do you. And I think that in terms of patients looking at who's going to provide them the best results, and I shouldn't say it's really the best results, but maybe results that are more tailored to that person, to you, the patient, individually. I mean, what do you agree on that, Ava? Or
Yeah, I completely agree. And one thing about your approach, which I really respect, is your attention to internal, making sure that nutrition is adequate and actually
right?
adequate, and also in terms of supplements too. But before we go there, I would really love to know, like, what do you think about the non-surgical body contouring? Because I know you do
Mhm.
liposuction, correct?
I do. I do. Yeah, that's a great question, because I think that really kind of separates the people that jump to operating, the people that say, you know what, we've got a lot of non-invasive techniques. We've got M sculpt, we've got cool sculpt, we've got cool tone, we've got, all the different variety of them. My personal take is there's several of them that are good. For me, it really depends on how extensive of an operation that I'm looking at doing, or how extensive of a transformation.
Mm-hmm.
I use a lot of Renuvion, which, for those of you who don't know what Renuvion is, it's wonderful for skin tightening. It uses helium energy and RF, which is radio frequency energy.
But
Um,
what
and
is Renuvian? Is that the injectable or is it a device?
no, it's actually it's a device. Think about like it's comparable to Body Tight, so InMode's platform. But
Mm-hmm.
what it does, you actually go and you undermine, you tunnel, and you create a potential space where that gas is going to go. Because you don't want to just say, you don't want to put the thing in, the wand in, and just let the gas go anywhere. You want to have it very controlled. But what happens is you put the gas in, and then it's instantaneously activated. It kicks off an electron by the addition of radio frequency energy. So you get a really quick heating effect. But then what's nice is it goes up really fast and it goes down really fast. So it's not bulk heating. So, and Ava, you know what this is, but for those of you who don't, bulk heating means that it's a very slow, think about it like slow and low cooking. Everything heats, all different layers. Here you actually don't want it all to heat, because when you do, you get the potential and increased potential for skin burn. So you get potential for epidermal injury, dermal injury. What you're really trying to do is you're really trying to tighten down. You've got all these little fibers that connect the skin and the deeper tissue, these little trabecular fibers. You want them to tighten in, and you want to stimulate collagen growth. But, back to your original question, it's interesting. I really try to evaluate that on a patient by patient basis, because some people are just, they're one and done. They want to get in, they want to do liposuction, they want to heal for maybe 4 or 5 days. Whereas other people will say, I'm really, really nervous about surgery for whatever reason. And that's a valid response. They're more, maybe say, of a cool sculpting patient. Are you using cool sculpting, or what's your modality like? Cool
Yeah,
sculpting?
cool
Yeah.
sculpting.
Yeah. So, I mean, I think, those patients, you say, well, the upside is there's no IVs. There's nothing. You can sit there and you can read a book while you're doing cold sculpting.
Right.
It's really, I've had it done, and it's really quite painless. I mean, there's one part of it, it's a little annoying where they rub the, the frozen butter part, but that's a
Yeah,
little bit
that
annoying.
sound. Yeah, I mean that's a little bit uncomfortable. I mean
Yeah.
we simmer the sound waves and it
Right.
improves the result for sure.
Right. Let me ask you a question. I'm going to turn that back on you. So, obviously, you have all the devices in the industry, and you're a very, very astute person in terms of knowing what each device can do. And I think as importantly, what each device maybe cannot do. In other words, the limits. How do you, if a patient came in, say I came in to talk to you and said, Dr. Shamban, I'm 53 years old. I got a little bit of that lower abdominal wall fluff, and I eat pretty well, but I like my martinis once in a while, and I'm not going to stop my martinis. How do I do that? How do you actually evaluate me and decide, am I someone that's good for your modality, or am I someone that you want to refer, for example, to a local body contouring surgeon?
Well, it's a good question because I think some of it has to do with the person's tolerance for multiple treatments. Because we know that cool sculpting works, but
Hmm.
it's not a single treatment. It's usually at least two treatments. And then you have to have the patience to wait for the tissue to tighten up. And so, people who really don't want it the downtime, they can have the cool sculpting, but they just have to know that it's going to take 6 to 12 months to really see a final result from two treatments.
Right.
And there's some people who come in. I mean, we know from your colleague Grant Stevens. They'll come in and they'll have a cool sculpting, cool sculpting arm attached everywhere, to the muffin top, to the belly fold, to the arm here. It's like they look like they're hooked up to, I don't know, being infused with.
Right.
So I think that, and then we can attack like sort of smaller areas with some Kybella, which is, for those who don't know, it's the fat dissolving injectable from Allergan. So that's also something that's useful. But I think that's true for liposuction too. I mean, sometimes the texture of the skin, you're just not going to get. You're not really necessarily, maybe like just keep the martinis and be happy with your size, because the
Hmm.
skin will just be kind of saggy and crumply. And so that's something that we don't really, I mean, that we don't, as dermatology, we don't really have the answer for yet. I mean, there's some of the injectables like the dilute radius, or doing
Right.
the ultrasound on top, and you can kind of approximate it, but I don't know. Sometimes I think they need liposuction and a tummy tuck. Like a
Right.
tummy tuck. What's your feeling?
Well, I'm gonna go back a little bit on what we were talking about, because I think you hit on some really, really good salient points. One thing that I really enjoyed about spending time with people other than plastic surgeons is that, I think we have been on top of it a little bit, but I think you guys have been probably more facile, and I'll use the word creative as well too, about accommodation therapy. And that's one thing that I really think, over the last 10 years, I've been in practice 20. I think, you're just a baby. So may not have been that.
I just look like a baby. Yeah, I'm,
You have
I'm
good skincare.
20 plus years myself.
There you go. So, I mean, what I've seen, as compared to what I was trained in, I was trained to cut is to cure. Everything is cutting,
I like that.
which,
Cut is to cure.
what's that?
To cut is to cure. That's good.
Right. Right. But what I've learned though is surgery is wonderful, but it ignores a lot of other things. It ignores. I mean, when I do a surgery, unless I'm doing concomitant laser resurfacing, unless I'm doing something in the OR to actually address the skin, what I've done now is I've taken the skin and I pulled it tighter. It's more taut, TAUT, but I really haven't improved the quality of it. And to me, that's not a comprehensive result. So, sitting on panels with you guys, I've really learned a ton. I mean, I literally, I tell people that I don't go to meetings, I go to ad boards. I think you and I have both been really blessed to be able to surround ourselves with people that are incredibly knowledgeable, incredibly articulate, and very creative and very ingenious about saying, hey, if I can achieve a result with, say, for this injectable, what about if I layer it with this energy device, or if I add on to this? And I think synergy is a word that I think is very often overused, but in our field, I think synergy is a word that's actually very applicable. I mean, really, it's not saying, okay, I'm only going to do a chemical peel, I'm only going to do a laser, I'm only going to do this. It's saying, well, there's probably multiple avenues to help achieve the same result, and let's see what's right for you, because not everything, what may be good for you, Ava, may not be good for me, because of skin type, age, area of the body, obviously gender, ethnic concerns. I mean, obviously in our patients of color, I mean, you have to watch, the heat of some of the energy, based devices. So it isn't a one size fits all.
It's very interesting because, to your point, I think that if you're doing, so I want to go back to the type of liposuction. You're putting a
Hmm.
gas, you put the probe in with a gas, and then the gas separates out the fat. Is that how that works?
No, what you do is it's a two-stage treatment. The first thing you do is you do liposuction, and you're either, you can aspirate or not aspirate. But what you're essentially doing with the liposuction is you're creating channels. Okay, so you're creating a potential space. When you do that, then you take the liposuction out, You put back in, I'll use my pen here. So here's a liposuction pen. I'm going in underneath the skin. I'm creating these areas where I want the gas to go. Then I take the liposuction out, again, with or without aspirating. So in other words, with or without removing fat. And then I take the Renuvion device. I put that in the skin. That releases localized small areas of gas that then are activated by radio frequency energy to basically go into the plasma state. So it goes from the gaseous to the plasma state. In doing that, it kicks off an electron, and a lot of energy is released in the form of it can't talk here, sorry, it tightens the underlying skin. So it's that 1-2 punch that, as plastic surgeons, one of the most challenging things that for us have been, what do we do with loose skin? Same thing for dermatologists, Yeah. I mean, basically, you either say, one, nothing, we can't do anything, or two, we cut it out, which cutting it, you have a scar. So right. The question has always been, how can you really tighten it? And we've, in the past, I've seen people, use a variety of, I've seen people use external chemical peels to try to cause some type of inflammatory response and tighten the collagen, improve elastin. I've also seen a lot of energy devices. I'd say for those of you watching this that, the interesting thing about our industry is things move so quickly. Then there are so many great technologies. I'm just blown away by what we're doing now versus even 5 years ago. I mean, in terms of what we're able to accomplish. But you really, when you look at some of these devices, you realize that unfortunately it's kind of the boulevard of broken dreams, that there's a lot of this stuff that we say, well, we can accomplish, X, Y, Z, and we don't. And so it's always a challenge. And how do you preface that to patients? Because I know expectations are really, really important in whatever specialty you're in. How do you sit down with that patient that says, Dr. Shamban, I'm 40 years old. This is my classic patient. I'm 40 years old, female, 40, 2 kids, going through a divorce. I'm going to the dating scene. I don't have any specific concerns. It's not like I have this big brown spot here or what have you, but Dr. Ava, I don't really look like I don't feel as vibrant as on the outside as I do on the inside. How do you evaluate that patient?
Well, that's a really good question, but I want to go back to the idea of the combination treatment to improve quality of skin. And that is something I always explain to my patients, is that if they're going to go have, a facelift or a neck lift or a tummy tuck or something, they're kind of wasting their money unless they have beautiful, like, glowing, luminous skin, because nobody, the patient may see it. They may see that this looks tighter, that looks tighter, but the quality of the skin is what everybody else sees. Mm-hmm. So I think that what I've found now is the idea of the laser assisted drug delivery, whether you're doing a fractionated laser or something, and then you can apply Sculptra on top of it, or PRP, and do that. And just, people have to understand, it's not a one and done. You need to do like 6 of them. I mean, literally, right, of them to really see a result. But if you improve the quality of the very top 2 layers, the dermis and the epidermis, then your surgery is going to look all that more magnificent. And the skin scholar likes this. You can't fix the inside without fixing the outside. Yes, that's why Dr. has a
I love that. I'll tell you, I love that term, though.
Because
so right on.
Yeah, and I think that before we talk about the patient, our patient who wants to look her best to get back on all those dating sites. Well, we'll go there for a minute. But I'd love for you to talk. I mean, I don't know if you've done some IG Lives talking about like your nutritional program and your supplements, because I think that, to everybody who's on the audience, you have to understand that we can do this, that, and the other thing in the office. But if you're not supporting your internal health by what you eat and what kind of supplements you take, you're not going to get the best healing response, and your skin's going to really show. Well, right. Thank you, Biscuit.
Yeah, and I think, yeah, what about me? No one's saying I look beautiful. Jeez.
You look handsome.
Thank you.
I can say that.
What I would say is, and you hit on something that I think it's very interesting. We get very little education. I mean, very little education in medical school and residency training on, the importance of nutrition. I mean, I can't speak for you, Ava, but for me, I mean, I was born and raised in the Pacific Northwest. it was funny because we were doing farm to table when it was just, we had people down the road that just happened to have a farm. That was our farm to table. We weren't yuppies or anything like that. In fact, our family was just very much just, that's what we did. That's what we do in Oregon. I mean, you want some blueberries, you go down the hill and you pick some blueberries, and it was all very, very fresh. And so I was born and raised around that. And now, what I realize is that was something that my parents imparted on me in terms of the importance of nutrition. And then, I went through a variety of things. I think, I did a little fitness competition thing, which is crazy, but I saw the power of food and the transformative nature of food. And I just sat down one morning, I had an Oprah aha moment. And I said, if I'm doing it for me in my way, because I want to look good, whatever, maybe it would be a benefit to my patients for healing. And I just started doing research. I did a fellowship in it. And I just, fell in love with the notion of using food as your medicine. And it's not a new concept. It's been around, but I think it's poorly misunderstood. I think that for the average consumer, I think it's like trying to find information on nutrition from the internet is like drinking through a fire hose. It's, what do I do? Do I do intermittent fasting? Do I do the Mediterranean diet? And here's my answer. Yes, yes, yes. So, and I mean that by the most important first step is that first step. The most important first step is saying, I've got to actually be thoughtful about my nutrition. One of my favorite sayings, a journey of 1,000 miles begins with a single step.
Right.
So, or in the words of Nike, just do it. So,
right.
It doesn't necessarily, you don't need to go in and just do this like crazy diet. And I think that's why a lot of people get turned off on eating healthy, because they think, well, I've got to throw away, I can't have my martini, I can't have my glass of wine, I can't have my, I can't have my piece of licorice. Yeah, you can. Just be, be thoughtful. I just got off a weekend, I can tell you, of, relaxing and, enjoying the sun, so to speak, with my sunblock. And, but, I also too, I treat myself because life's too short. But back to what you're saying though, I think what we're realizing is, what the derms have taught me, what you guys have taught me is the skin is the largest organ in your body. And if you expect that your skin's going to look really good when you eat poorly, and if you just do a lot of Botox or fillers and so forth, it's not. I mean, it's it's kind of like watering your plants with gasoline. It's it's not going to do anything.
Yeah, so. There's a movie called Idiocracy, which is kind of shocking to watch. It was made in like '08 or something. And it's like about the current day, and they're feeding the plants with like Gatorade, essentially. And like, surprisingly, nothing's growing. So yes, the so-called empty calories. There was a question, everybody who's listening, please, hit us up with some questions. And there was a question about scars. What was the question about the scars? Let's see.
Can you find it? Because if not, I've got a question that actually someone sent me as well, too.
Okay, why don't you start with that one?
So it's just a broad-based question. Between a dermatologist and a plastic surgeon, who should I see for a scar revision? We all have scars.
That was a scar, yeah.
Yeah. So what do you think? I mean, what are
Blanket, yeah. It depends on the scar, right? I mean, it depends on the location on the body, and it depends on what caused the scar. Is the scar raised? Is the scar indented? Is it an acne scar? Is the scar pigmented? Does the scar have a lot of vessels? It was scar revision dermoplastic. I mean, if it's a scar, it depends. I mean, scars on the face, you can actually laser resurface really successfully, and you won't even see the scar. Scars on the legs, I mean, I think those scars, maybe that's something you would want a surgeon to revise. A scar that's been treated by a dermatologist with laser and it's still not gone, laser injections, then that would be a scar to go to see a surgeon. I don't know. What would your
I think it's funny because it's, I intentionally wanted to create some dialogue between, the fight between the derm and the plastics and so forth. But what's so funny though is you'd probably take me down on that one. So
you think so? I don't know. I've got this too.
There you go. Just don't cut yourself. So No, what I would say is I think it depends on the training of the person, because just to broadly label someone as a dermatologist or plastic surgeon, I actually see my practice as actually a lot of dermatology. I do a lot of skin in my practice. I don't do, I do a fraction of what you do, Ava. I mean, obviously, but I also too, I have much greater respect for skin. And in terms of management of scars, I'm doing a lot of filler injection of scars, for example, treat with Botox, which I wasn't trained to do that. I wasn't trained to squirt stuff in scars, but I had a patient the other day, beautiful young girl, 18 years old, came down from the mountains. She had a long-standing scar to her forehead, was really bothering her, and we put some filler in there one time, and I told her, I said, yeah, we might need to do some microneedling PRP. She emailed me a photo a couple days later. She's like, I don't need anything more. She goes, thank you. She goes, you really, really changed how I look at myself. And it's funny because little things like that, we think that they're so big. And in reality, I'm not downplaying it, but the amount of effect, the change you can make in someone's life by just even changing a facial scar, you're like, wow. I mean, you're like, that's amazing. Takes a couple extra minutes, no big deal, very little downtime. And again, it was not the way I was trained as a plastic surgeon. I mean, in fact, actually, if anything, I think I probably, I learned most of what I know in terms of injectables from a lot of hit or miss. And don't worry, patients, when I was doing that was not your hit or miss. But
Practicing on your staff for everybody.
What's that?
I just said you were practicing on your staff. That's where we
right, exactly. But you learn over time, and you learn. What I found is, I have no problem, and I've called you many times. I've called a lot of my other friends, a lot of people in our groups, and said, hey, I've got a challenging case. What would you do with this? Because you can never be so arrogant that you think you know everything. I always tell people, the day you know everything, it's time to retire. If your ego is so big that you can't listen to someone else, hang up the shingle. I've got a wonderful PA in my office. Shout out to Lauren. She and I actually, we've started doing this thing where, a lot of times we had a little bit of downtime. I'll bring her into the rooms and I'll say, hey, what do you think about this? What would you do? And I don't tell her anything. And I thoughtfully want to know, are there blind spots? Are there things that I'm missing? So what I would say is, when you look at, we posed the question, it was a very playful question about, who's better, a derm or plastic surgeon? I would say whichever one actually listens to you, and whichever one actually also listens to their peers, because someone that really, there's a Chinese saying about why you have 2 ears and 1 mouth. Okay, you should use them that much accordingly. And it's always good to listen, because once you do that, I pick up I'm like a sponge when I go to ad boards or when I go to meetings. I learn probably more outside of the meeting than I do inside the meeting. Just saying, hey, Ava, what do you do? I have this patient with problem skin for, I don't know, redness or tightness. What do you think about this new thing? And I get a very different response than someone that's maybe in my profession, in my specialty.
I think it's really true. The interaction is really important. Now, I want to address a couple questions. There's a question about what's the difference, Nick by the Bay? What's the difference between a keloid and a hypertrophic scar? So from a dermatologic point of view, the difference is, by definition, a keloid grows beyond the boundaries of the scar itself. And also can just start up from almost nothing, just like a bug bite on a chest. You can get a keloid, and sometimes they just start on their own because it's really made by the cells that make the collagen, and then they just go out of control. And hypertrophic scar is just a thickened scar that appears right at the actual wound. Would you agree with that?
I totally agree with that. And I think it's funny because I think most people get them confused all the time. And I think a majority of people actually mistake hypertrophic scars for keloids. Keloids are not very common. Keloids tend to be more in specific skin types, more, and correct me if I'm wrong, but more in skin of color. Also, what's interesting as well too, if you look at the head and neck, for example, keloids are more in the head. They're more common laterally. You don't tend to see keloids medially. And then when you go down to the chest, it's the opposite. They tend to occur on the sternum in the middle, But like I do a lot of breast augmentation, and I see a lot of patients, my dark skin Hispanics, my African Americans, my Asian patients that are type fives. I mean, they're a little darker skin,
Hmm.
and I really don't have issues with keloids.
Hmm. Yeah, yeah, it's interesting because I agree on the face. Really, in Asian skin, you can see keloids along the jawline and certainly
Hmm.
get them where the ear piercing. But I agree, it's much more common on the chest and the back. I had many years ago, I had a young woman from Jamaica, and she had shingles, and she developed they were keloid all wherever she had the shingles. It was terrible. Now, someone also asked about fine lines being treated with PRP and microneedling.
Hmm.
And so for Say Biscuit, I mean, I would say yes, it can help. It can help get rid of the lines, but sometimes you need to have a more intense treatment, such as a
Right.
surfacing or filler. I mean, have you been doing any of the micro injections of filler?
I have actually. We combine basically we do microtox. You obviously know what microtox. For you guys who don't know, it's basically you can use any of the toxins, Dysport, Xeomin, Botox, Jeuveau, Daxi when it comes out. But you do it in very small amounts. We don't actually understand exactly how it works. I think we're kind of still trying to figure that out. We know on a cellular level some of the things that happen, but what's wonderful though is creating these microchannels with PRP. We've done, or I'm not with PRP, with microneedling. I'm sorry. And in the past, I don't know, Ava, if you probably did a lot of fractional laser resurfacing and use that as a conduit. Did
Yeah,
you?
yeah.
Yeah.
And you can use that for PRP, and also, as I said, we're using the very dilute Sculptra, which is one of the tissue
Hmm.
stimulators, and applying that on top of a fractionated whatever treatment. Oh, that is.
You got a busy household.
I got my dog here. I've got my best friend housekeeper. We're gonna
The
live with
life of Ava.
the life of Ava.
So I got asked another question as well too. And since both you and I do a lot of facial injectables, people are wondering what are nodules? What are nodules? Um,
Are
excuse me.
not. Oh my
You
God,
know,
that.
we could do a whole talk on this.
What? Let's talk before we want to talk about the RHA products. They've just
Yeah.
come out. The RHA. Have
Yep.
you had a chance to try them?
Unfortunately, so Revance reached out to me. I have not had the chance to try them, and the only reason being is I'll be perfectly honest. Since opening up here, and I'm sure you're the same way, it's just been absolutely slammed. I mean, it's a good problem to have, but we've all we've all been wearing two or three hats in the office. I'm in the process, hopefully, of opening a new office. Um, Between all that, I couldn't do it as well, and I don't. Well, the last thing I want to do, and you and I have worked with a lot of companies where they ask, hey, can you trial this product? I think it's only fair if we're going to trial it in a time when you really have enough energy and enough bandwidth to really give it an honest approach and an honest evaluation. But just simply to use it as free product, it's not helping the company, and it's not
No,
helping the patients.
I
So
agree, but I can give you a report from the front because I have
go
had
for it.
time with the product, and also I was an investigator for the product. And it's very interesting because the way it's manufactured is different from the first generation products, I'll call them. So it's still a complex sugar that's in the skin, but the process of formation is done at a lower temperature. And so it turns out that the chains of the hyaluronic acid are more similar to the native ones that we have in our skin. And
Hmm.
also, because of the way they're processing it, they use less cross linking, so it's not as stiff. And so it moves better with the skin. And what it appears is to integrate much better into the skin. And you can use, depending on the product, 2, 3, and 4. And so they're distinguished really by how much cross-linking they have, with the
Right.
4 having cross-linking and being most similar, and it's kind of more contouring, injected deeper. But I really like that. I really like the product. So that's kind of what's new in filler land. But we were going to talk. What were we going to talk about?
we're talking about nodules, but we
Oh yeah,
can,
nodules. Oh yeah, I want
I
to talk
mean,
about.
we can either talk about that or even the future of the injectables as well too, because I think both you and I know there's a lot of really very interesting products coming in the market in the next couple of years.
Yeah,
Um,
let's talk about that because nodules. I mean, people who are on, they don't want to hear about nodules really,
right,
unless you guys
right.
have a question if someone has a nodule. But let's talk about, yeah. What do you see? What kind of technology do you see that
You know,
future?
I think really where the future lies is biostimulation. And what that means basically is, in the past we basically used it as a little like putty. We have a little line, a dent, we put it in, we pop it out, and we live happily ever after. With products like Sculptra, with Radius to a degree, with some of your HAs, I know some of the products that Allergan, I can't discuss them, but they're going to be coming out in the next couple of years for skin quality. I think what we're going to be doing is we're going to be seeing a lot more emphasis on biostimulation. In other words, not just that it's a one-two approach or a one-two punch. So you're not just putting in product, but you're putting in product that's actually active. It's not inert. So many of us, and Ava, I'm sure you do this as well too. We've been combining PRP, which is for those of you who don't know, it's called platelet-rich plasma. You draw your blood, you spin it down, and the platelet-rich plasma basically is this beautiful layer that has all kinds of wonderful stimulatory factors that have been shown to do anything from thicken the skin to help address scars to there's been a lot of claims that have been very fraudulent. It does regardless of what, and I won't mention who says this, but regardless of this person saying it, it does not do a breast lift. There's no such thing as a breast lift with it, but many other things that you can do. And the other thing too, and this is near and dear to me, is so I had a hair transplant about a year and a half ago or so, and this scalp's full of PRP. It's so easy. And this is coming from a guy who hates having his blood drawn. I'm like a little kid. Yes, I'm that surgeon that runs around and and doesn't like his blood. Your blood's fine, but I don't want to see my own blood. But so drawing the blood and using it for your scalp. There's some wonderful guys out there that have been hair transplant surgeons that have been taking that to a whole new level. And the thing that my patients love too, we have a lot of these patients that are, very natural and so forth, which I respect. There's nothing more natural than your own blood. I mean, it's your body. So they really appreciate that, and it's a really easy thing to do. And it's not real painful. It's a blood draw, quick blood draw, and then small needles. And results, they can be somewhat unpredictable. That's the downside of it. I never guarantee any results just because I've seen some amazing results, and I've seen some that have been, we said, well, let's try that again. That wasn't as good. And
Yeah,
whether the timing,
are you talking about PRP for scalp, for hair?
I'm talking about PRP for scalp. Yeah,
For
yeah,
scalp.
yeah,
Yeah.
yeah. And
How many treatments are you doing for the patients? Once a month? Tell me
you
about
know,
what it is.
I've gotten away from just using straightforward PRP, and I'm combining it for the most part with what is called ACell. ACell's basically a wound healing matrix. The downside of ACell is it's a little thicker, and so you've got to use a bigger needle. So what we do, and I'm usually the guinea pig for all these things. So we did this before I
Honor tradition. Go on.
basically my PA injected my scalp, and we didn't do a ring block. Please have your doctor do a ring block. It doesn't feel very good. So it was a little uncomfortable, but it wasn't undoable or not doable, I should say. And I really do think I got a nice result. I really do. And I think it's
How many
hard to measure.
how many
So
treatments do you have? How many treatments?
I probably, total over the last couple of years, I probably had about maybe 6 or 7 treatments, something like that.
Mm-hmm.
And the ACell, I'm doing it. My protocol is twice a year with ACell.
Mm-hmm.
If you're going to do just standard PRP, the standard platelet-rich plasma alone, then I recommend about 4 treatments, each about 4 to 6 weeks apart.
Mm-hmm.
And it's a wonderful way to increase the density of the hair. It's great for both men and women. I think with I not that I don't feel bad for men, but for women especially in a society where it's very judgmental, it's definitely a double standard. You know, guys tend to have thinning hair, and as well, you know, you look a little bit more mature, what have you. No woman comes to my office says, you know, I'm so glad that I've got temporal wasting and, you know, loss of hair here and right in the center. No one ever says that, because it can actually be devastating. I mean, it's really, when you thicken their hair, and the difference there, and you know this probably better than I do, is a lot of that tends to be a little bit more medically oriented, thyroid issues. I mean, some of the other, you know, dermatologic concerns that can cause that. But when you help someone with their hair, and I'm a patient. I mean, my hair wasn't, I don't think, horrible, but it's, you know, having it thicker now, it gives me
You
more
feel
confidence.
good. Well, I think also it just feels feel more youthful. I don't know.
Right, right,
Yeah. No, I think I'm getting
right.
PRP too, because I used to. It was all of a sudden I realized, oh my God, my hair. I used to have like my hair has always been fine, but I used to have like a ponytail that was, you know, like this big. Now it's like this big. It's like, wait a minute, what happened there? So, but I know with the hair cycle, it really, you know, can take 4 months. So I think that I'm recommending 6 treatments a month apart. I think that's sort of more
Right.
reasonable. And then obviously the supplements. I mean, you know, and the supplements, I mean, that but it varies from individual to individual. And obviously, if a woman comes in with hair loss, then we check, as you said, you know, we check thyroid, we check
Mm-hmm.
not anemic, we check for lupus, we check for, you know, any underlying medical conditions that could contribute to the hair loss.
Right.
Interesting, there's a new medicine, and I think you and I were on the same advisory board for the eye drops that help the pseudotosis. Were you on that advisory?
Yeah,
You
yeah,
were.
yeah,
That's
yeah. This was last weekend, wasn't it?
yeah.
Yeah.
No, there was one. There was another. There was one a while. Maybe you were on a more recent one. I was on one. I thought you were on that one with me. Anyway, I think that's going to be really exciting because as you get older, your eyes start to do this, and then it just pops your eyes open. I think that's some exciting medication. New, it's approved, so that should be coming. They're rolling it out to some ophthalmologists. I begged for some to see if we could try it, and then that'll be out soon.
We've got a question. Is there a time when you would say PRP would not be helpful in a young male, 19, with familial hair loss? You know, I'll take that one real quick. There's really no downside to it. I think that the most important thing in whatever we do within, you know, aesthetics or what have you, is really setting realistic expectations. So I don't want to just take my patient's money. If I think something's going to work, I have a saying with my patients, I'm not afraid to spend your money, but I'm going to spend it wisely. So if I don't think something's going to work, then I'm going to be very adamant about saying, you know, my gut tells me it's not going to work. PRP is not that way. I've seen some really nice results. And I'd say, you know, as someone that, for the gentleman that wrote this for 19, you know, doing something like hair grafting at 19, and you know, my hair grafting colleagues may disagree with me. I think you've got to be very careful, because someone that's losing their hair that quickly at that early of an age, you can end up putting the hair in the front, and all of a sudden the hair behind it goes away, and then you end up with this little hair island. So you've got to be very, very careful. Whereas someone like myself that's, you know, early 50s, you know, what I'm seeing is more traditional hair loss at a little bit more predictable age. So yeah, so for you guys that are young, I mean, key thing, Propecia, something like Nutrafol, or I don't know if you've tried Hush Hush. The company reached out to me. It's a newer company. What else here? And then also too, PRP as well too. Neograft is what I use, where it's basically follicular unit extraction. Simple terms, it doesn't give you those cornrow nonsense. It looks very natural. But I think that for me, I don't usually treat people until I've kind of figured out kind of what's going on with their hair, because what I don't want to do is move all their hair into the front and now have it disappear and right behind that, and now we're chasing our tail.
Right. You know, it's an interesting also question about whether if you're taking hair follicles from an area that are not testosterone sensitive, and then you kind of maybe sprinkle them in, whether you could change the programming. But
Right.
Ruth Muscat has a question about, you mean the company for the eye drops? Do you remember the name of the company? If I can't remember it, what you could do is direct message me on my my page, Dr. Ava Says, or also Beauty by Buford, and we'll find out. But
Right.
I don't recall right now. But the eye drops, they're really great because you just put them in once a day. They last the entire day, and that's all you have to do, and it will
You
take.
know, actually, who I heard about this from, I think, is John Feza.
I don't. I mean, there was a couple new things that popped up, and I did add boards on, and I don't remember the name but I can't remember the name. I want to say Eon, but I don't know. But it's coming, and then I think if you follow both of our pages, we'll be making an announcement. I know we will because
Right.
it's a really nice adjunct to everything that we
It's a
do.
very no, it's a very nice one.
Now,
So
what
I mean, go
about the
ahead.
maintenance? Someone asked about maintenance for PRP for hair. What would you say? What would you say the maintenance is?
And that's where it gets back more to the art, because what I always tell people, there's only one way to stop aging. Um, our good friend Mary Lupo had an awesome comment. In fact, I think you remember that you were at Cosmetic Boot Camp. One of her patients asked, "How do I make a facelift last forever?" Do you remember this one?
What'd she
Her
say?
comment her comment was, "Die the next day." You know, typical Mary Lupo combo. So shout out to Mary. There you go. But it's so true, and I tell my patients there's only one way to stop aging, and it's a horrible option, but that's really the only one way to stop it. So to answer your question, how many times do I do PRP? I just say it really depends. It depends on. I've seen lectures where hair transplant surgeons. I saw one a couple of years ago. I think it was Wendy Roberts' meeting, and one of the gentlemen that was speaking there said, he does PRP for like every 2-3 months on himself, and he's got a great head of hair. Now, most people don't have access to that, to all that stuff. But if you can, though, I do think PRP has very, very, very few downsides, other than getting poked.
Yeah,
But other than that, it's really,
there's
it's
no
really good.
there's yeah, there's no downside. I mean, as you say, it's like allergenic. It comes from you. You can't be allergic to it. And so I'm finding it like I'm putting PRP in my arms. I'm putting PRP.
Hmm.
I want to see what kind of results I get. But I think in terms of maintenance, I think quarterly, like 3 to 4 times a year, depending on how often you're in the office, is ideal. Now, also, someone asked about thoughts about CBD. I'm assuming
Hmm.
you mean CBD topically, like in a cream. And also, I
Hmm.
want to say for hair loss too, that I was just listening to a lecture as part of the Master's of Aesthetics faculty, and there was a very good lecture on hair. And what they were saying was that minoxidil, the active in Rogaine, people are now taking orally, and then the spironolactone, they're looking at a topical form, as well as Propecia. They're looking at a topical form of the finasteride. But anyway, but back to CBD. Do you have any? Are you selling any creams that have CBD in them, or what are your thoughts?
Well, I mean, we're in Colorado, so I mean, if you don't know, everything about THC and CBD, they kick you out of Colorado. You lose your ability to live here. But no, all jokes aside, we've not used it for skincare. What we've used it for, though, is we actually recommend CBD for post-op pain,
Mm-hmm.
because it's wonderful for that. I've used it for sports related injuries. I use an oil based. I don't tend to use a cream, but you can use a cream. But the oil based, I just have patients, for example, I do a lot of breast augmentation. And generally, most patients up here at the muscle, that's where they get the spasm. And so I just have them literally rub it on that area, and also take it under the tongue as well, too.
And
And it's
like a tincture of
Yeah,
CBD.
yeah, yeah, and it's actually wonderful for anxiety. It's funny, once you start the conversation, inevitably someone will say, "Oh my God, I'm giving CBD to my dog who has arthritis. My grandmother, she has aching joints. It works beautifully." Same thing. What I would say with CBD, the challenge is it's a little bit of it's not a little bit, it's the Wild West. So make sure you know the purity. Make sure you know that it doesn't have THC. You don't want that surprise. I work with a lot of law enforcement, a lot of professional athletes, and so they get drug tested. And same thing for me. I don't get drug tested, but I don't want THC during the day for obvious reasons. And
Right.
so I've taken brands that have CBD that
Yes.
are wonderful.
Yeah. Yeah.
So it's
Well, it's interesting. So for those who are listening, CBD can be derived from hemp, which has no
mhm.
THC. It doesn't have any of it's not a hallucinogen. I don't know what you call it, but CBD you can also get from the plants that where you get THC also, right?
Right. Right.
But CBD is a very potent anti-inflammatory, and we have cannabinoid receptors on every cell in our. And so CBD. That's why we have all those receptors. But I think that it's going to become a very useful anti-inflammatory agent, you know, to your point. And it also seems to, if it, I hadn't heard that it relaxes muscle spasm, but
Hmm.
so it's targeting something there. And I guess that would be, I guess that's not that bizarre, because people take it and they relax. You know, it's a
Right.
central, must be a central relaxation. I don't know. But we know it's anti-inflammatory. We know it's
Right. Right.
So should we go? We can go back to the 40-year-old woman who's just out of her marriage and ready to roll.
Right.
And so, I mean, the first thing I explain to women if they're ready to start dating is that, you know, and I'm sure you can confirm this, men are not looking at the same things that we women look at. You know, like we'll look at a little thing of cellulite and we'll go like, oh my God, I'm ruined. Or, you know, you've got like one little wrinkle or something like that. But men don't really care. I mean, you know, some women at a certain point, like they look at themselves and they're very critical. But, you know, it depends on what this woman's goals are. I mean, who she wants to look good for. Does she want to look good for herself? Or she wants to look good for, you know, the opposite sex. That's what she's into, or the same sex. But it's, you know, it's a very, I mean, for me, and you know my perspective on beauty, you know, for me, it's all about making an individual look like themselves and just a little bit more. So whatever that takes, whether it's a little facial contouring, a little improvement of the skin, a little body contouring, you know, that's my approach. What about yours?
I'm going to depart from that a little bit. You said it depends on who the person is trying to look good for. I try to make them look good for themselves. And the reason being is I think that to me, one of the most beautiful things about anyone is that internal confidence. You know, if you think about it, you walk into a room or someone walks in a room and they have confidence. They may not be the best looking person in the room, both male or female, what have you, but they just shine. I mean, they've just got this energy, and you're like, man, I don't know what this aura this person has, but you know, I just want to talk to them. I want to be. You're kind of drawn in like a, you know, moth to the flame, so to speak. So what I try to figure out is, you know, every face has a beautiful component. Every face, whether it's a nose, cheeks, eyes. First, I try to find that whatever looks the best and not screw it up.
Right. That's the signature feature. That's what I talk about.
Right.
Yeah.
Right.
Yeah.
And then the second thing is I try to look and say, you know what around that signature feature is going to help that person look their very best, because, you know, like I said, everybody has a beautiful attribute. And it's also about, you know, what's going to make them, you know, what makes you Ava, what makes me. I mean, it's, you know, and I think that's the exciting thing about beauty is we can look at you know, the measurements. We can look at the golden ratio and all this kind of stuff. But ultimately, when it comes down to it, some of those most beautiful people are the most unsymmetric, most asymmetric. You know, they have big noses. They may have a, you know, a big mole in their cheek, or they may have a chin that's protruding a little bit. But that's what makes them them. And without it, I mean, look at what's her name from Dirty Dancing, Jennifer Grey. I mean, she literally threw away her career when she had her nose done, because that
Yeah.
really defined her. And after that, she stopped getting a lot of roles. So
Yeah.
you got to be very, very careful.
Believe me, she regrets that. Yeah, I don't know. It wasn't really her choice, but yeah. Yeah, no, I think that's really true. And I love that. You see, all the women watching, see what a man says, they're drawn to like feeling a woman who feels confident in herself. You know,
Right.
doesn't matter
Right.
what your weight, doesn't matter what your income is, it doesn't even matter so much how old you are, right? It's really
Totally
about
agree.
how you carry yourself. So,
To
yeah,
me, to me, Ava, confidence is, I mean, the most beautiful women. I mean, you know, look at someone like, look at Sophia Loren. Look at,
well, these are beautiful women.
oh, I'm trying to think of, and this is one
Gardner,
of my favorite actresses,
Ava
Audrey Hepburn. Audrey Hepburn.
Audrey Hepburn, Ava Gardner. I was just
Oh,
reading an interview with Jane Fonda, who's like 84. So she had So when she was young, you know, she met like these icons, you know, Marilyn Monroe and Ava Gardner. And she said the most beautiful woman she'd ever met was Ava Gardner,
Hmm.
who I was named after, by the way. Not that she had a body. Oh my God, she had a body that could launch a ship. Ava Gardner, not so much here, but she said Marilyn Monroe just like lit up the room. You know, you can understand how she really. Anyway, those are you know, movie stars, magnificent beauties before anybody did anything to them, by the way.
Right.
But there's a question from Say Biscuit about body sculpting on the M sculpt. So I'll answer that first because we're just about out of time here. But I love the M sculpt, love, 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 because this is the first time there's been any kind of device to address the muscle laxity that we see after people have had multiple children, or just even if you've been injured or have had surgery and you've lost some of that tightness. It's really phenomenal. And now we can do the abdomen, we can do the bottom, the derriere, we can do the front and back of the thigh, we can do the biceps and the triceps. And what's really interesting, and I don't know, I mean, I'm hopping on that machine as much as I can, but what's really interesting is that it seems like you feel stronger overall and feel better. And I think there has to be some kind of an increase in growth hormone or something. And it's fascinating. Hey, have you have one of these devices? Have you ever?
You know, I actually don't. I don't. For me, for my practice pattern, it wasn't a good fit, and
Mhm.
that's neither here nor there. I mean, I just didn't get it. Plus, it's in my area of the woods in Denver. There's a lot of devices, so it's become a little bit too common. But I know a lot of people that love it. That a lot of people love it. And I think, you know, even more important than the one single device is the fact that we're now looking at various ways to accomplish, you know, muscle tightening, address, you know, non-surgically address muscle separation. You know, there's the cool tone as well too that, you know, this came out from Allergan a short while back. But I think that what's really neat is being in the aesthetic industry. I just remember when I first started, and we were in the infancy. I mean, what we were doing with injectables, what we were doing with, you know, a variety of treatments, we're kind of throwing things against the wall and seeing what stuck. Now, going to some of these meetings, as a surgeon, I have to say, you know, I'm really pretty impressed by a lot of these non-surgical procedures. And what's neat is I can combine them now with surgery, but it's not. People ask, you know, is surgery ever going to go away? Absolutely not. Surgery is never going to go away. But is surgery good or is it bad? Neither. Is non-invasive good or bad? Neither. It's
Yeah.
all on how you use it. It's a tool. And so it's really understanding, or let's just say an instrument. I mean, you could sit me down at, you know, at a baby grand. I play piano and I can play it relatively well. Same piano you put down a concert pianist, and they're just going to play it just, you know, beautifully, 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 beautifully. And so what we're trying to really understand in the aesthetic arena is, you know, not necessarily trying to come up with new products and new devices every other week, but trying to figure out what are the unmet needs, what are the untapped needs, what are the things that we think are going to be they're going to be good in the long run. So I think it looks like we've got about a
We're
minute
done. Yeah,
left, and
yeah, done. Yeah,
we're
so I wanted to say how much I appreciate your perspective. And I didn't know you were a piano player, but I can't wait to hear you. And it's just wonderful to have you as a colleague to help inform a lot of my decisions and to help educate me as well. So,
Well, Ava, it's a pleasure. It's great talking to you. And for those of you who joined in, this is Dr. Ava Shamban, board certified dermatologist in Los Angeles. I'm Greg Buford. I'm a plastic surgeon here in Denver, Colorado. And our goal is to basically talk to you about the art of aesthetics and the realization that there are no right or wrong answers. There's just creativity, and let that grow. So,
thank you to everyone. And also, I just want to put a plug in for my YouTube show, which I'm a co-host on, called The Gist. And Dr. Buford will be a guest. We're just generating our COVID season. So
I was gonna say you need to get
follow.
the skinny white boy on there. You know.
Yeah, we got to get the skinny white boy on there. Yeah, we're really anyway. So DM either of us. So thank you, everybody.
Cheers. You have a great night, guys.